Hello, everyone. Welcome and thank you for attending. I'm Anne-Marie Slivey, Director of Economic Development in Orange. We have about 27 business owners here today on the call. Some of you have submitted questions already, and we'll be covering those questions in the end. If you want to submit a question, we'll discuss that after the selected 5 questions, and you would submit your question via chat. Your video and sound is off right now. So like I said, if you want to submit something, just use the chat feature. I'd like to introduce our four panelists. We have Dr. Amir Mohammad. He's the Director of Health for the town. Brian Slugoski, he is the Sanitarian. We have Chief Robert Gagne and Tino Russo, who's the Emergency Management Director. I'll have each panelist give an update on what they've been doing concerning COVID in the business community. And like I said, after the update, we will cover the submitted questions. And then if there's any questions you want to submit, that would be in the end as well. So thank you to our panelists, and I'll have Dr. Mohammad give his update first.
Good morning, everybody. Thank you, Anne-Marie, for organizing this webinar and getting our business partners to talk to us and connect with us directly. So thank you all for participating in this. So I just wanted to update you what we have been doing as a health department, in this pandemic. As you know, we have been closely monitoring since the first case was reported in Connecticut as well as in town of Orange. There have been several executive orders, quite a bit of guidance, since May 20th when we have the opening or reopening phases. So at this time, the focus has been to help you kick off your reopening by providing some limited PPEs that we received through the Department of Public Health and CBIA. I've asked Tino's team to distribute it, whatever we have. We have not just corporate businesses, but also healthcare facilities, urgent cares, some rehab centers and the like. So the needs are different. What I've been doing is I've been closely looking at some of the federal guidance as well from OSHA standpoint, like what they are trying to put forward in terms of protecting the staff, your staff, the workers, as well as the customers. So I'm sure you all are aware of that. It's a moving target. Things do change, but in general, I think if you follow the good practices to ensure that your team, the workers that you have in your businesses, they remain healthy, safety, and if they are symptomatic and they're seeking appropriate care at the appropriate time. So it's a team effort by everyone, and we're here to assist you and guide you as much as possible. You have to reach out to us. We provide frequent guidance on our website, but we also wanted you to all look at the state website because some things may change. We have the health department has weekly calls with the state, and we all talk about it. So I understand that you have your businesses, your customers may come from anywhere in Connecticut, but in our town, we first of all in Connecticut we have almost 43,000 cases, and the deaths have been reported as 4,000. The good sign is that the hospitalizations are decreasing. Again, that's the trend at the moment. I do expect cases to go up maybe a little bit after reopening. However, what I've personally observed going out to the business, not all of them, but some, that people are not following appropriate guidance. Some businesses and corporations are very strict about it, which is good. But I think the key here is to ensure that the behavior remains consistent with what the guidance we have received. So you have to enforce these things at your facilities, at your businesses for the time being. I think it will probably be next several months that mask and proper social distancing should be in place. So that's sort of a general guidance. And if there are anything specific, that we can go into the details, but start off with this, and then we can certainly help you develop a plan. This is all I would like to at least say in the beginning, and back to you, Anne-Marie.
Okay, thank you, Dr. Mohammad. Next, we have Brian Slugoski, the town sanitarian. Brian?
Good morning. Really, since the beginning of March, our main job here at the health department was to conduct patient interviews and to conduct the contact tracing for all the COVID-19 cases and of persons of interest. We've also monitored these existing patients as to their progress. Obviously, I've also done inspections and complaint investigations regarding to COVID-19 and to the following of the sector rules. Also, one of our responsibilities here is, through emails and mass mailings, disseminate the information to the public, as to what the governor's executive orders are pertaining to, your certain businesses that you run, notice or declarations from the director of health, and then the sector rule guidance for the phase 1 opening, and then obviously with the other phases coming. And we also provide assistance and support for all the other departments, our first responders, such as police, fire, AMR, the OVNA. And obviously we meet every week with the emergency management team to give them updates. So that's what we're doing on this end. And I'm mostly in contact with all our licensed establishments, including restaurants, cosmetology salons, hotels, fitness centers. We're trying to have a good dialogue and making sure that they get the sector guidance for their particular business. And if anyone has any questions for our department or need any clarifications or they're confused about anything, they can contact us, and we'll try and guide them. So that's all I have on this side.
Okay. We do have a few questions concerning personal services such as massage and the salons, which we'll cover later, and I'm sure Brian will comment on that. Next, we have Chief Gagne. If you could give us a report if you've seen any increase in safety, or you could just let us know what you're doing concerning the business community.
Public, basically we've changed the way we do things a little bit. We have adapted our response to medicals to make sure our officers do it in a safe way. We are the medical first responder for the town of Orange, and AMR backs us up on that. So we've been working closely with our partners at AMR to make sure everyone stays safe. We've responded differently to the way we handle certain complaints. Whatever we could do over the phone, we are doing over the phone rather than sending an officer in person. So we've changed our protocols a bit during this pandemic. For the most part, we haven't seen very many issues at all. We are concerned that people walking around with masks and walking into a business, in the past, that was a telltale sign that you have a problem about to happen. And now everybody has a mask on. So we're aware of that. We have not seen an uptick in any criminal activity, but we are cognizant of the potential for it. Early on when the pandemic started, some of the communities surrounding us saw an uptick in some robberies, people walking in to an establishment with a mask on. So we have instructed our officers to be very, very visible and to pay particular attention to those businesses that are potentially prone to robbery type complaints. So we're out there, we're being visible. And since the reopening, we've been working with the restaurants. We haven't had a large number of them, but several of them have asked for the outdoor dining permit that's temporary in nature. And we have worked with those restaurants to make sure they're able to do that in a safe way. The last thing we want is a dining area in the middle of a parking lot with no safety and somebody getting hurt by a car, whether the car loses control because someone's not paying attention or they step on the gas instead of the brake. There's potential for a real safety issue there. So we've been working with the restaurants that have asked us to make sure they segregate the dining areas into a safe area of the parking lot, and or they have jersey type barriers set up that are kind of protect people while they're dining. People aren't paying attention when they're dining. They're concentrating on their food and on their meal and on the conversation, and they're not cognizant of what's going on around them with vehicles. So we've got to make sure that what we do is done safely and is going to protect those people. Other than that, we haven't seen a lot of issues. We haven't gotten any complaints about non-compliance, so things are going fairly well in that regard.
Okay, great. Thank you for that update. And next we have Tino Russo. He's working with the emergency management. And Tino, if you could tell us what you've been doing. I know you've been distributing thermometers through the CBIA for the business community. So if you could let us know a little bit about that. Your sound is off. There you go.
Okay, there we go. Also, by the way, Dr. Amir asked to be unmuted. He may have had a comment. He just called me if someone can unmute him.
Okay.
He's been trying to unmute. It doesn't work unless you do it for us.
Okay, no better. I can, yeah.
Amir, did you have something?
No, go ahead, Tino. It may come back and I'll remind.
Okay, fine. Yeah, hi, everybody. It's Tino Russo. I'm the Deputy Director of Emergency Management, and I chair the COVID-19 subcommittee. Our job in emergency management, if you're not familiar with it, we're involved very much with the planning for emergencies, and also running the Emergency Operations Center if we have a declared emergency, which of course we do in this case. We also do the town interface to the Department of Emergency Management and Homeland Security. That's a state agency. And that's where we go for help with resources and PPE, which is something you all might be looking for at this particular point in time. At this time, as it relates to the business community, and I think I've met some of you, I'm looking at the names here. We've been distributing things like thermometers, which have been provided by the CBIA. And if any of you have put a request in through their web portal, we're the ones who ultimately wind up with them and have the responsibility to get them to you in some form or fashion. We've done that in 2 different ways. If you're on their list and we just receive a list and some supplies, we generally will email that list and say we're going to be providing a distribution, which is always at High Plains Community Center. It varies time and day, and it's a curbside pickup. Some of you may have already gone through that and picked up your thermometer. If not, we do at times deliver them. People call us and they can't make the pod point of delivery, and we'll actually show up when we can and either hand them to you or put them in the mailbox. That's one flow of PPE. There are a number of sources. There's another source that comes through the Department of Health, DPH. That's the one that Dr. Mohammad is involved with. And on behalf of the health department, I've been visiting the various medical organizations within town, whether they be doctors, dentists, or what have you, and requesting whether they needed help with PPE. Now, being perfectly honest, there's not a lot of PPE available at this time. It varies from week to week, and different things become very difficult to get, whether it's through the state or the health department. And just to answer the question, N95 masks, which are the sort of high-level ones that are needed by people who are actually potentially touching COVID-infected individuals, are very, very difficult to get. But we're able to get surgical masks, thermometers through the CBIA. We've had some shields, some gowns, that sort of thing. And I'm not sure any of that stuff is used by anyone in particular on this call, but those are the sort of things that we're distributing to the medical community. And if there's any questions, I'll certainly be more than willing to answer them. So back to you, Anne-Marie.
Okay. Okay, now we will have our questions. I'm going to pull up the questions now. So these were the questions that were submitted previously. And like I said, based on what the panelists have discussed, if you have any other questions after this presentation is done, you can use the chat. We do have the types of businesses that are on the call right now. We have office, we have hotel, we have fitness centers, dance studio, an entertainment lounge. So they might There's also a manufacturer, so there might be something that these gentlemen can let you know as long as you let us know what you need. So the first question is relating to spas. If you have any insight on when will facials and massages be allowed. In addition, I had gotten a late question about the guidelines on spa business. So if Dr. Mohammad or Brian, you have any insight to that?
Well, as of right now, there's been no information as to when these facilities will open. However, every day changes. I check the governor's website for his executive orders and for which sectors that these businesses will open. I'm sure we'll find out in the next days or so what will be allowed for phase 2. But as of right now, I can't tell you when facials or massage establishments can reopen.
Right. Thanks, Brian. And to add to that, I think it's going to be under the same category as parlors and salons and others. So that's my guess, is that these are closed until June 20th. So maybe we'll receive some guidance before that. And that may include further guidance about these activities. So stay tuned.
I will say that sorry, Amir, the minute I get it, the next minute you guys will get it. So as soon as I find out, I try to disseminate that information as fast as I can so everyone is in the know. And of course, with sector guidelines as well, I try to get that out pretty quickly so that everyone's on board. And then if anyone has any questions, we could work things out before the actual opening. But it's possible phase 2, which is tentatively scheduled for June 20th, maybe that time.
Yeah, I just wanted to add too, in phase 2, there's a category that's personal services, and still very vague. There's no really description of that, but I would think that personal services could be facials and massage and things like that, nail services. So it's information we don't have yet until the state releases it. And like Brian said, he gets it out quick. And when I get the information from the state, I as well send out emails through Constant Contact, and I put it on my website. So we're doing our best to get the information out there. The second question, with the reopening of my massage business, I'll be following the state guidelines for massage businesses under AMTA and CDC. She wanted to know what guidelines would the town of Orange require, if there's any additional guidelines or.
So, yeah, I can start off with that. In terms of guidelines, the state AMTA or CDC is the sort of standard. Depending on what specific situation it is in massage business, then we can provide additional guidance. But I would say that strict to these guidelines, you would do fine if you meet all these guidelines. However, if there are any questions and there are some alternatives, then we can certainly look into it and provide you some guidance. But start with the CDCs.
Okay, perfect. Thank you. Brian, did you need to add anything?
Well, obviously, when the sector guidelines come out, they'll be specific and detailed as to to what will be expected. And I'm sure the sector guidelines do follow AMTA and CDC guidelines as well.
Okay, thank you. The next question is, when will fitness and wellness center facilities, personal training studios, and gym owners receive reopening guidelines? I know personally I don't have any of that yet. I know that as soon as the state releases it, I'll know, but I don't know if the health department has any insight to that.
Well, no insight at this time. We will see what's in the second phase 2 after June 20th. However, I would say, we have few fitness centers and gym. I go to one of those. So I think it's important that these businesses come up with a plan. The basic is having 50% occupancy, social distance, or keeping the equipments, more cleaning, more wipes available for both the customers and those who are in the housekeeping. So I think if all the businesses can work onto that, their own standardized operating procedures that will help them reopen in 20 days or 3 weeks or so. So come up with your own plan, because we cannot come up and specifically tell you what size and number of customers or gym participants you have. So you look at your roster, see how you're going to manage it, considering that it's not going to be fully open. It's going to be in, this is my guess is that it's going to be in transition. You would have at least starting off with maybe 25-50% occupancy and then kind of go from there, but you may have to reshuffle where the equipments are being placed and how would you organize by keeping the social distance, ensuring that the masks are being worn when folks are not actively exercising. Obviously, it will impede with some breathing process, but when they're walking, going going from one place to other. So those are the things that I would say, these businesses should keep in mind and come up with some strategy. So it's not everything you're working on the very last minute. Obviously, those who go to the gyms and fitness center are eagerly looking to return. And the other thing that I was thinking about it, some of the bigger gyms and fitness center where they have, hundreds of people at a given time, I think, again, this is my opinion, that we don't have any guidance at this time. I think it would be better if you can come up with the time schedule, right? So hour or 2 hour window where certain people can come in or sign up beforehand and access the gym equipment. And then when they go out, the second cohort can come in. So thinking on that line, again, nothing is written on the stone. We will see more guidance, but these would be the smartest way of kind of following the guidelines and keeping everybody safe and healthy while you reopen these fitness centers.
Okay, great. Thank you. Brian, did you need to add anything to that?
Well, right now, fitness centers fall in that same category as massage and facials. We just don't know exactly. I mean, I've heard hints, phase 2, but nothing has really been etched in stone on that. But to back up what Dr. Mohammad say, I'd say some of the basic things they'd be looking for is an occupancy restriction at first. So I mean, if a gym can have 200 at one time, they may be limited to maybe 50% of their capacity. And again, these are just kind of guesses, like Dr. Mohammad said. The mask requirement may be still in effect for people to go in and work out. The social distancing between equipment may be another issue, but we'll see. I mean, again, as I said, once if there is a plan for it in phase 2, we'll know soon. And then obviously we'll let the fitness centers know right away, so they can plan, whatever alterations they may need to make in the facility.
Okay, thank you. Dr. Mohammad, are there any health issues with wearing a mask and working out?
So I think it's not feasible if you're running on the treadmill. Everyone's has a different respiratory status. Those people who are fit and healthy are the ones who, pretty much go to the gym and they're regular participants in these activities. I mean, it would be very uncomfortable if your heart is beating fast and your, oxygenation is up at the rate your, breathing rates are high. So I don't think it's the best idea when you're actively working out. But if you're doing some slow bicycling and some non-exertion activity, perhaps you can. But I cannot generalize it. Everyone has different thresholds. So from medical standpoint, obviously those who have underlying heart or lung conditions should avoid, wearing masks while they're actively working out, because that may impede further oxygenation. What I would say that just have all the members come with the mask. I think this is going to be standardized with everybody in any business going out. So if I go to my gym or fitness center, I'll keep my mask on and then use it when it's needed. But from environmental standpoint, there has to be appropriate distancing and all that. But I would say it depends on individuals' health status, and not all of them would be able to wear it while exercising.
Okay, thank you. And that almost leads into our next question. I'm interested in learning protocol for our fitness center to safely open. We work with people with autism. We have a mask policy acknowledging that not all our members can wear a mask and they will never be asked to do so. We are sensitive in responding to this special population. How should business owners respond to patrons entering their business without a mask? And can a business owner consider a person to enter without a mask due to having a special need such as autism?
Yeah, I mean, I think it depends on a case-by-case basis. So autism in of itself is not absolute contraindication why they cannot, wear masks. If somebody can tolerate, if they're accompanied by some family member that may be helpful for entering, I think we just have to look at more carefully what the situation is. But remember, if the members or the business's employees are wearing masks, at least there's some barrier. I would say for folks who have autistic disorders and cannot comply, they need to be checked with temperature and other symptoms. So if they're not sick, main issue is when they enter into any facility while they're sick and they cannot protect themselves by wearing the mask. So those are the things I would say that be cognizant of, and develop some sort of SOP where you are checking the temperature and asking the parent or family member if they have any symptoms. So we have to go by that. I mean, we have to be creative. This is a great social experiment that we all are involved with. This is how I tell my kids and everybody, we don't know all the answers. We don't know how each situation may affect, but on a large scale, we can do things that are sort of, more generalized. So without, again, going into the nitty gritty of it, but, we have to apply other preventive measures in special population like that.
And they also commented, which you might have covered already, but can we collectively discuss a graceful way of balancing an important and urgent mask policy while also being sensitive to kids with special needs and their parents who accompany and speak for them?
Yeah.
You just mentioned, taking their temperature instead of having a mask and just following all those guidelines.
Yeah, I mean, everybody's aware of what the situation is, and whatever we're doing is for the benefit of their child, right? So we are as sensitive as they could be, and we want to help them in a safe manner. So I'm pretty sure that they would be receptive to the ideas, what other preventive measures can be taken, and they would be sensitive. They would be sensitive to the response. So my hope is that everyone is now changing some of the behavior that they used to exhibit. Now it's different times, and we all have to be more flexible than before.
Okay. Great, thank you.
Anne-Marie, it's Chief Gagne. Could I weigh in on that a second?
Yes, absolutely.
So I just want it to be known, our officers are given extensive training on dealing with special populations, and including those with autism. So our officers have all been trained in that, and they are very sensitive to how to deal with someone with autism. But having said that, one of the concerns here is that people get confused as to why they're wearing a mask. The mask isn't worn to protect you, it's to protect others from you. That's why the masks are being worn. So if someone comes into a business without a mask, those employees might be concerned for their own safety that this person is talking, breathing, they're getting it on me, they're going to infect me. So they may have a concern that the person doesn't have the mask. And so now you get into a situation where you're explaining why this person doesn't have a mask, whether it's autism or they have a actual medical certificate that they can't wear a mask because. So those conversations are going to happen. Ultimately, it's kind of up to the business owner. If they're not comfortable having someone without a mask come into the business, that's their option. And if we get called because it starts escalating, certainly we're not looking to do this in an enforcement role. We're looking to resolve the issue and hey, you're supposed to have a mask on, and then it's going to get into why they don't have the mask on, and the police are there, which may upset the person even further. So the best thing to do is try to avoid those situations altogether wherever and whenever possible. If you don't have to go in, if the person is old enough that they could wait in the car, if you could go without the person to the business. So if it's predictable, it's preventable. So if you prevent putting yourself in a situation that's going to cause a problem, that would be prudent.
Okay, thank you. Does anyone else need to comment on the situation with the mask in the fitness studio? Okay, we'll move on to our last question, and then after that, we'll go into the chat room. Unfortunately, I can't access chat and have the questions up on the screen at the same time, but okay, the next one is they are a dance studio and they focus on private lessons. Would the town of Orange allow us to open before June 20th? They were hoping to open June 8th or June 15th, because June 20th is a Saturday, which again delays their ability to create income. They have instituted a reopening policy as allocated by the CDC. There are no more than 7 people within a 2,500 square foot studio. They will not be doing any close one-on-one dancing, and there will be 6 feet social distancing with masks and gloves at all times. Also noting that they heard from another dance studio in Brantford and New Britain, and that they are opening earlier as approved by their town mayor, since the ballroom dance studios are no different than the closeness the public has in a hair salon or restaurant. So I guess first I'll ask Brian, because he institutes the town policy. Do you think that they'll be able to open up before the date if they have discussions with the town on what they're doing?
Well, that would be strictly up to our director of health as well, Dr.
Okay.
Mohammad. But
Yeah,
I think it's something that, we obviously can discuss, offline. We definitely would want to see an SOP and to see how things would be handled. But I mean, we're always willing to talk to businesses, and if we come to some sort of an agreement, then it's possible.
Yeah. And yes, we are flexible and we are pro-business also. At the same time, we want to ensure that, every operations is done with safety and as a priority. So obviously we are happy to take a look into it. I always consider these dance studios kind of the same definition as fitness and gym, but perhaps they may not classify with that, and they can implement all the, so I'm happy to take a look at it, and both Brian and I can have an offline discussion with the owner, and we can look at their SOPs and kind of go from there.
Okay, great. Thank you. I've just entered the chat, and I'll begin with our first question. One of the challenges in getting businesses back online is that many employees have been pressed into childcare duty with the closing of schools. Is the town of Orange Park and Rec day camp opening this summer, and what is the latest on schools being fully opened on time in September, and who makes the final decision on reopening?
So I can start off with that. So Orange Park and Rec are planning to offer day camp with limited students' participation, so they can look into their website and see what the newest. I had a discussion, I looked at their SOP, and they are going to provide some activities along with following the preventive measures. So please look at their website and get the full details. So in terms of a school, it's primarily, Board of Education or the state's education department looking into it. And we also look at some of the steps that the school district is taking place. I am hopeful that come September, come fall, we would have a better understanding of how we are going to reopen. There are a lot of talks about assessing the general prevalence of infection in the state. It's too early to say that we are anywhere close to make a final decision of reopening, but let's stay positive. Let's be optimistic about it, and it's too early to kind of have final determination. But I can assure that we will be working hands in hands with the Department of Education and our school superintendent, which we have done from the day one, to ensure that all the safety precautions are being met before the schools are reopened.
Okay.
Brian, you want to add anything?
Well, just I would just piggyback on that. Yes, we're in contact with the Board of Education superintendent, every week, and I'm sure we'll be in contact with him, on Friday for our emergency preparedness meetings. And we could always ask him, is there been talks of what the plan will be come late August or early September openings? And, he'll keep us in the loop on that. Mm-hmm. But we haven't even finished this school year, so I think they're probably going to want to let's finish out this school year and then see from there where they're going to go with it.
Yeah.
Okay, great, thank you. Every week there's an emergency management committee meeting with Tino Russo, and like Brian just mentioned, he's attending, and as well as a bunch of others, people from the community center. So just to let you know, every week they meet and discuss all the goings on in the town relating to COVID. The next question is concerning cleaning materials and hand sanitizers. They're hard to get, which are assuming are must-have procure before the business is open. Will the town be looking to help provide them? Maybe that might be a question for Tino Russo. I think that you just deal with the medical with those types of things. I'm not sure if you can get.
Yeah, we haven't received much. I mean, the only hand sanitizer bottles we've received are, personal, very small size. I don't know how many mils are these, but these are personal little bottles that can go into your pocket. So obviously not sufficient enough for these businesses. Yeah, unfortunately, we haven't received anything from the health department looking at cleaning materials per se, specifically the gloves, the gowns, some of the face shields. That these are the PPE equipments we have received. But I think you have to contact your supply chain and distributors. I know it's very tightly supplied at many places, and it would be a challenge. Tino, do you have anything to add on?
Yeah, the flow on that is not very large right now. The only ones we've been receiving are the little personal ones that people would carry in their pocket. However, one of the things I do is I sort of get a sense of what's available, from the various retail outlets, and I can tell you it's improved immensely. I know CVS has them, but you have to ask at the counter. They have the larger containers, that might be usable for many of the businesses. So I would suggest you try going into a CVS and straight out ask them, do you have any hand sanitizers? And you might be surprised. They have had them for the last week, pretty much every time I've checked. Also, Walmart has them, and their stock runs out early in the morning. So if you want them, you need to get there at 7 a.m. in the morning, and they usually last for about 45 minutes until until they run out of supply. But I suggest you check around locally. You might be surprised what you can purchase.
Tino, if anyone has any contracts with office supply companies such as WB Mason, they also can supply hand sanitizer and some things as well. I mean, the big thing is I think these places have it, but they need to order it as well. So if you put your orders in now, you might have it by the time the Sector 2 opening is available. So I think it's out there. It's, as Tino said, you just got to kind of find it and then get your orders in and just be patient on it.
Great, thank you. I also have a list of distributors that I've been collecting every time I get notification that, this company distributes various things. So I can also send that to you, AJ, the list of who has it. And again, their supplies might be back ordered, but it's worth a shot. And like Brian said, be cognizant of pre-ordering early because it may take a few weeks. It looks like that is the last question. So I don't know if anyone else wants to add any questions. The chat will be open for a few minutes. Do any of the panelists have anything else to comment on based on what we spoke to about today? Okay. And just know that, the public, just know that we are here, and, give me a call anytime if you have questions. Like I said, Brian is around and will help you out and direct you and get you any information that you need. So I just wanted to thank our panelists today for attending, and thank everyone else for attending. And again, give us a call if you have any concerns, and we can also set up one of these calls again in another 2 weeks, maybe when phase 2 opens, just to see if there's any other questions the business community may have. So with that, I'll guess I will be ending the Zoom, and thanks again for everyone attending.
Take care, everybody. Be
Yeah.
safe.
Okay.
Stay safe, everyone.
Have a good day.
Thanks.
Bye.